अगर it's possible है ऐसा,
why not?
Why not? I mean, why I'm suffering from the last 8 years?
I got it.
I've never seen a doctor who gives so much confidence. In fact, not in the OPD also, But before the surgery, you asked me what is going in my mind, and I've told you very well, that this is what I fear about. And then you showed me a video, and that gave me so much confidence of that 60-year-old man.
Yeah.
So that's a booster for me. So that's one thing, that I've personally I have not seen in my 35 years. Probably one or two, but not seen too many doctors who give this kind of connect. So that's one thing I really loved before the surgery. While surgery, I guess yes. I was able to feel things, walking, and apart from that surgical pain, rest everything is
good.
Almost good. My mom told me, I've showed the video, that I'm walking a little bit straight.
Yeah.
Previously, I used to bend a little bit. So that's one thing, good thing. And we did the leg raise exercise right after the surgery. So that didn't give me any pain.
Yeah.
And in fact, today I'm able to close both the legs and I'm not feeling it.
No.
I guess it's almost like 95%.
95% better?
Yes.
Okay. So
probably if I won't feel this surgical pain, which probably you saying the 2-3 days will go away, I guess 100% is already done.
So I have my patient Bhavesh. So Bhavesh, आप मेरे को बताओगे आपको क्या प्रॉब्लम होती है?
From the last 8 years, the kind of a sciatica pain. So from the hip to the thighs to the calves and to the ankle.
It's always been on the left side.
Left side.
So can you just a little bit in briefer way tell me what kind of treatments you've already tried for it?
It's diagnosed in 2014, and after that some painkillers and basic physiotherapy. That's it. You
never tried?
Yeah. And after that, somebody advised me to do swimming. So that relieved me better, but obviously it keeps on coming.
It didn't solve the problem. Okay, tell me one thing. Has ever surgery been suggested to you? No. So, and did the pain is the same intensity since it was then before, or it has increased or something?
Gradually it increased, decreased, then increased, and then subtle. And then I have thought myself that I have to live with this forever. And I made my body like this. कि when I walk, मुझे दर्द होता था, तो मैं थोड़ी देर रुक जाता था, तो settle हो जाता था pain. Then I start walking. So I made up my mind कि I have to live like this, because surgery, open surgery, you can't do it, and none of the doctor advised to me in this age. Maybe अगर in 65 years older, when I will not able to walk properly, then I can think of it.
Okay.
So that's the thing. But gradually, from 3 weeks ago, suddenly, shooting pain has happened, which never happened in the last 8 years. So that, made me thought that something has gone wrong, and I need to see a doctor again.
And then we got the scans done.
Yeah.
And then we realized that it's not only the disc, it's an opacified disc, or the disc which is hardened during the time. And it's right sitting next to your L5-S1 disc, which is hurting the left nerve. So we proposed to do his endoscopic discectomy, preferably under local anesthesia with no sedation. And we want him to keep awake. And that's what the trial is. But if things go wrong, we may end up doing an L5-S1 interlaminar discectomy. So tell me, what are your thoughts about surgery? What do you think now?
I made up my mind, so I'm cool.
You're cool?
Yeah, I think. Obviously, the way you explain, what can it cause it over. If I can, avoid it further, then, going in that position, it's better, to get it done.
Yeah, it's been a while actually. Yeah. So you've been actually modifying your lifestyle just because of a simple disc. And I'm sure you must have gone through multiple blogs in which you would have found that people have gotten over it.
Yeah.
And it's possible.
And that's the only reason I came to you, because I was actually searching who is the best in here in NCR. So I was just searching the videos, and I just got few of the videos, and I started seeing the first video I saw, as I have spoke to you before.
Yeah.
That guy, that college guy, was like 21, 22 year old.
Yeah.
And then he said that he was having pain from the last 2 years. And the moment you treated him, in fact, within the same day he was walking, and then he was crying that he's so happy that he got it, removed. But he was so, tense that why he didn't got to you earlier 1 year before, so that he would avoided the pain for the last 2 years.
Yes, sure.
So I was thinking that only, कि यार अगर it's possible है ऐसा,
why not?
Why not? Why I'm suffering from the last 8 years?
I got it. And so right now, how is the pain situation? Is it hurting you badly, or is it kind of controlled?
I mean, since the day I met you and the few medicines I've took, so I'm not doing anything like just sitting and relaxing. So maybe because of that, I'm not
Getting it worse.
So
But before you came down to me, the last 2 nights were quite messy. Eh?
it was. I mean, I never ever cried because of this pain in the last 8 years. But that day I cried. Literally, I was not able to sit down. I was not able to lie down. I was not able to walk, and I was like, my posture has slighted down to the 40 degrees.
My goodness, like you're like walking bent. That's what
Yeah.
your wife was telling me. Oh my god. Okay, so large big fragment. We're going to take it out, and we'll ask you again. How do you feel after the surgery? As very standard, we do that, and we hope you will recover with like full colors and like 100%.
Because I mean, people ask me every time, why don't you shred your weight? And these are the two main problems, that I can't even do the yoga properly. I can't do the walking properly because of the prolonged walking. Because 5 minutes walking doesn't help you to reduce your weight, or even 5 minutes sitting of the yoga will not help you. At least you have to do 30, 40 or 1 hour.
Oh yeah, 1
Person like me who want to shed the weight.
Yes, absolutely.
But if you can't do it, the basic steps obviously you can't think of to go to gym.
Yes, that's true.
So that's what I thought. How can I reduce it? And food, obviously, it's gonna be, but there's definitely
But certainly, you need to follow a regimen. So let's hope for the best, and I wish you all best of luck. And then let's see you after the surgery, and then we'll discuss it again.
Thank you, sir.
So I have my patient Bhavesh, sir. So we operated you yesterday.
Yeah.
And like we discussed your case day before yesterday. So let's start with the surgical experience. How was the surgery per se?
I was really afraid before that, but I must say, I've not, first of all, a little feedback for you. I've never seen a doctor who gives so much confidence. In fact, not in the OPD also, But before the surgery, you asked me what is going in my mind, and I've told you very well, that this is what I fear about. And then you showed me a video, and that gave me so much confidence of that 60-year-old man and all that. So that's a booster for me. So that's one thing that I've personally I have not seen in my 35 years. Probably 1 or 2, but not seen too many doctors who give this kind of connect. So that's one thing I really loved before the surgery. While surgery, I guess yes. I was able to feel things.
And also give me the real-time feedback. Yes.
Yes, and I gave you the real-time feedback.
Whenever there was a pain in the leg, you would tell me.
So, but that was a plan of action, right?
Yes, that was very much expected. Right. I didn't want them to knock you down because if you were asleep, who would tell me that I'm touching the nerve? So the patient itself in endoscopy acts as a monitor, and the result is in front of you. So tell me how you feel today. It's like, I think 12 hours or more than that after surgery. How do you feel?
I'm walking, and apart from that surgical pain, rest everything is
good.
Almost good. My mom told me, I've showed the video, that I'm walking a little bit straight.
Yeah.
Previously, I used to bend a little bit. So that's one thing, good thing. And we did the leg raise exercise right after the surgery. So that didn't give me any pain.
Yeah.
And in fact, today I'm able to close both the legs and I'm not feeling it.
No. But that time when you used to internally rotate the leg, it will give you pain.
Yes. But
now it's gone.
Perfect.
So if I would have asked you the almost an average amount of percentage of relief, what would you say pre-surgery and post-surgery?
I guess it's almost like 95%.
95% better?
Yes.
Okay. So
probably if I won't feel this surgical pain, which probably you're saying the 2-3 days will go away, I guess 100% is already done.
That's more than amazing. More than amazing. So see, Bhavesh, this is a very important perspective why we do this video, right?
Yeah.
There are people who are suffering. You must have gone through some of the videos of mine.
I'm the one.
Yes. So would you like to give some words of advice or some words of your feelings to them who are right now suffering and looking at the video and actually trusting and not able to trust that what will go through them?
Well, first of all, it's very difficult to find a right doctor. So I think people who are watching this video, they can understand, they will have that first step is already closed. So you come here, you can consult with Mr. Dr. Devashish. And the one thing which I have felt from the last 8 years, nobody was there to guide me up. And why did I suffer this pain for the almost 8 years? And I have avoided many things. I'm passionate person to drive too much. I want to track also. I want to, go here and there. But because of this pain and all that stuff, I always have to, cancel that, because I can't walk for that 15-20 minutes in stretch.
That's like a compromise in your
Right.
original lifestyle.
So I guess, people who are suffering, at least now the technology is so advanced, and touch wood, we have such good doctors. So people can come forward. They do not about to fear about anything about the surgery. I think my case would have been not that complex, but there are too many complex cases, that I have already seen in the video, which already been, worked really well, and people are really loving it and enjoying their life. So I guess, people should not afraid, consult, and probably you can get over your pain.
Cheers to that. So I always want to say that, if you have that problem, it's not good to suffer. Go to your spine specialist, consult, and endoscopic spine surgery is really a boon in which patient is awake, and that gives us double confidence that there will be no nerve damage. So cheers to that. Thank you so much.
Thank you so much for treating me well.
And thank you so much for trusting us. And you have to build that trust to actually allow me to operate on somebody's body, right?
You're going to be very busy in coming months because a lot of my colleagues, as I mentioned, that they have something or the similar problem, and I'm definitely, because they were asking that please go ahead and share the feedback, and definitely.
So it's like they were like, पहले इसका हो जाने देते हैं, and then
so they were thinking, that let's try. Obviously it's a mental cycle,
Yes.
that let's कोई close relative है हमारा, and let's
Yes.
let him do that, and whatever the feedback is, then definitely
we'll plan it. Cheers to that. Fair enough. ठीक है sir. Thanks very much. Thank you so much.
Doctor.